Hello, everyone. It's Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you all know, this is a webinar where we talk about Lyme disease. I look forward to seeing what you have in store with me tonight because you create this webinar with your questions, and I'll try to answer those questions to the best of my ability. Every now and then I do get some insights from you and things that I need to look into a little bit more, so I'm interested to see what you have in store with me for that too. So I am creating a recording of tonight's webinar. So if you happen to miss one of my responses and you want more information, you can go ahead and listen to the recorded version tomorrow. You can also, during the webinar, I'll be pointing out to you resources that you can read at my Treat Lyme by Marty Ross MD website that you could look at even before the recording comes out tomorrow. So, most of the things we'll talk about, I have written something about it, and that's a good resource that you can look at as well too. So tonight I see a number of new names, and I'm glad to see there's new people coming here. I also see a lot of familiar names on my message board too, and which means you're getting value out of this. And so I'm glad to see that. And if you are getting value, for those of you that are new, if you get value, and those of you that keep coming back, if you are getting value, I'd appreciate it if you'd share what we're doing here by sending out the email notifications for the webinars, as well as the recording email that I send out tomorrow morning as well too. So for tomorrow, when you get that recording in the morning, it'll have a link for the webinar recording, so where you can go look at it. In addition, it's going to have a link to sign up for the next series of webinars, which will begin in March. I will be taking next week off. I usually do these about 3 in a month, and I'll take one Thursday afternoon off. So that happens to be next Thursday. I won't be doing the webinar with you. But I will, again, in the email tomorrow morning, be able to sign up for the next series, okay? So during the webinar, I will post the questions on the screen so that those of you that are participating in the live version can see them. However, those questions do not show up in the recorded version, all right? So I will be reading them out loud so that people that are listening in on the recorded version can follow what's happening here as well too, okay? So without any further ado, let's go ahead and get started here. All right, first question is from Brenda. Hi, Brenda. Let's see, have you used azlocillin to treat Lyme? Is it available in the US? Also, have you heard of using insulin to treat Lyme disease? Are there any new Lyme disease treatments? Thanks for all you do. So in terms of azlocillin is a type of penicillin antibiotic. And where it's gotten some attention is the lab at Stanford University that discovered that disulfiram, which is antabuse, the alcoholism drug, they discovered that it can help treat persister Lyme. And I think many of you are familiar with disulfiram. That same lab also has been researching and trying to find other things that we might be able to use to treat persisters. And they discovered in their lab that azlocillin can treat persister Lyme as well as growing Lyme. And in addition, they then went one step further and they did mouse experiments and found that in the mice, they had good results as well too. The one thing I want to let you know about the azlocillin is even though it can treat growing forms of Lyme and it can treat these hibernator persisting forms of Lyme, and it at least is shown to do so in the lab and is shown to do in mice, we have no idea whether they work in humans. So anything that works in a mouse or works in a lab doesn't necessarily mean it will work in a human, okay? So I want everyone to keep that in mind too. But the problem is another problem with azlocillin is it's not manufactured by anyone. So the researchers that came up with this idea at Stanford, Dr. Rohatis and his lab, they were able to find some to do the experiment, but there is not a known manufacturer of the medication at this point. My understanding is that Dr. Rohatis was looking with his group to put together some type of investors to start manufacturing. I honestly have not heard any further follow-up as to whether that's going to happen at all or not. The other thing I would say, if he does try to do that, he's taking a great risk because, again, just because it works in a mouse does not mean it's going to work in a human, okay? So to give you an example of that, there's another laboratory at Johns Hopkins University, a lab run by a physician named Ying Zhang. Dr. Zhang has been doing some really incredible research as well, looking at ways that we can treat these persister forms of Lyme and these persister forms of Bartonella. And his lab a number of years ago showed that if we did a combination of an IV antibiotic called cefparazone, I believe with cefotaxime, which is an IV antibiotic, and then also doxycycline, that they showed in laboratory experiments and they showed in mouse experiments, great killing of persister Lyme, got rid of all the germs, et cetera, okay? When we went to use it in humans, we found rotten results. So I just caution you. I know there's a lot of people that have read about Dr. Rohatys's work on azlocillin. Everyone's excited about it, but I don't know if it's going to work in humans. It has worked in mice, but we don't know if it'll work in humans, okay? All right. So for those of you that aren't familiar with this idea of persisters, this is just a quick review. So we know that Lyme germs have a growing state and then these states called persisters. Bartonella does too. They have growing forms of the germ and they have these persister forms, all right? So you can think of persisters as being some of the germs go into hibernation. They slow their metabolism way down and they just start ignoring all the antibiotics that we throw at them. Okay, so the standard antibiotics like your penicillins, your doxycyclines, rifampin, prescription antibiotics, the general prescription antibiotics we use cannot touch a persister. That's what the problem has been. Okay, so we've got these various labs that are looking at novel ways to treat it. Dr. Zhang's lab has discovered, for instance, that oregano oil is something that can be useful for persister Bart and persister Lyme. He's also discovered that methylene blue, which is a medicine we have to have compounded, can be successful against persister Lyme and persister Bart. And then Dr. Rohatys's lab discovered that disulfiram can be useful for persister Lyme, but it's not useful for persister Bartonella. And in fact, recent work by Dr. Zhang's lab at Johns Hopkins showed that it does not treat persister Bartonella. Okay, so I get asked that question quite a bit too. In terms of insulin, you know, I'm starting to see questions come through, and then I have an occasional person that comes into my clinic for somebody that's tried insulin on them. I am very skeptical that this is going to be a treatment that works. It is not considered anything in the mainstream of those of us that treat Lyme, and I'm skeptical that this is the way to get rid of Lyme infection, okay? Are there any novel new Lyme disease treatments that I'm aware of? I mean, the most new novel one is the disulfiram. There are some proponents of this idea of using, well, I'll leave it at that. There's nothing I have seen that is effective. The latest newer type treatment that is effective is the disulfiram. Okay. All right. So thanks for that question. Good luck to you. Let's see here. Hello, Gail. Let's see. Hi, Dr. Ross. Would pulsing IV Rocephin 6 times per month work for Lyme? And can it work alone, or do you need other antibiotics combined with it? Number 2, well, actually, yeah, let me read the rest of it. Number 2, can you do pulsed Rocephin as a standalone Lyme treatment if you've never treated with anything else before? Number 3, would you need to take oral antibiotics daily while doing the IV pulsing? 4, is methylene blue and rifampin a good combo to kill Bartonella? 5, okay, that's a lot of questions. Let me try to answer the first parts about Rocephin. So IV Rocephin can be pulsed, but the regimen that we have found historically to be most effective is one, if you're going to pulse it, is one where you would do 2 grams twice a day for 4 days in a row and then 3 days off. I have not had any working experience using it as you're suggesting 6 times per month. I am doubtful it would be effective. I'm doubtful it would be high enough of a level or leave high enough drug levels to get a good kill. I would not use Rocephin as a standalone treatment because it's not, Rocephin would only be useful at getting at the spirochete growing forms of the Lyme germ. But we also know that Lyme can exist as a microscopic cyst form, and the Rocephin does not do anything for the microscopic cyst. The other problem with Rocephin is it's good at treating things in what's known as the extracellular space. outside of your cells. Lyme can live outside of cells, but Lyme also lives inside of cells. And the Rocephin by itself is not going to be useful at getting at intracellular Lyme that lives inside of the cell. So I would not build a treatment that uses just Rocephin alone. And pulsing 6 times a month, I'm very skeptical that would make a difference. Again, the way that many of us would pulse if we're going to use Rocephin would be 4 days on, 3 days off. But on the days we use it, we would use it at a really high dose of 2 grams twice a day. Okay. Let's see here. Would you take oral antibiotics daily while doing IV pulsing? Yeah, I mean, if I were to do a pulse with the Rocephin, I would do the 4 days on, 3 days off, as I just said. And I might combine that with either tinidazole or metronidazole. The reason I would combine it with those is they will treat intracellular Lyme, and they can also treat the cyst form of Lyme. Okay, so that's one option. Possibly combining it with rifampin. Rifampin can treat cyst Lyme and can treat intracellular Lyme as well too. So yeah, I would combine it with some other things. Let's see, is methylene blue and rifampin a good combo to kill Bartonella? If we look at Ying Zhang's research that I mentioned earlier, that got published in April or May of 2020, Dr. Zhang looked at various combinations to treat growing Bartonella and persister Bartonella. One of those combinations that looked good in lab experiments is methylene blue along with rifampin. It also, in this experiments, methylene blue along with azithromycin was quite helpful too. Okay. Now, his experiments were looking at, can you treat growing forms, which is what the azithromycin or the rifampin would do, and can you treat the persister forms, which is what the methylene blue do. And also he showed methylene blue was good at getting rid of biofilms that can cover the germs as well too. These are lab experiments, okay? In the real world, I tend to like using 2 prescription antibiotic combinations to treat the growing forms of Bartonella, while I use either a methylene blue or an oregano oil to treat the persister forms, okay? So it could work, as you're suggesting here, but I find it's better to use 2 prescriptions that treat growing forms along with either methylene blue and rifampin or both together. I'll show you an article that you can take a look at that explains that to you in greater detail here in a minute. Let's see, number 5. Could the rifampin methylene blue kill chlamydia pneumoniae or Lyme at all? Yeah, the methylene blue has been shown in Ying Zhang's lab to treat persister Lyme, and rifampin is something we can use to treat Lyme, growing Lyme, but I wouldn't use it alone. I usually would combine it with a second antibiotic. Could they treat chlamydia pneumoniae? Yeah, that is possible. Number 6, does methylene blue wipe out the good bacteria in the gut and urogenital tract like antibiotics can? Okay, so the methylene blue. Okay, so methylene blue, everyone, let me talk about what that is. So I already talked about Lyme can have growing forms and these persister forms, okay? And so can Bartonella. Bartonella can have growing form, a growing state, I should say, and can have a persister hibernating state, okay? Most antibiotics, again, work well on the growing forms because things like penicillins and doxycyclines and Biaxin and azithromycin and rifampin do better if something is growing, okay? The issue with a non-growing germ is how do you get the germ to destabilize? And although we're not 100% sure how methylene blue works, some preliminary data tells us that it makes the covering of the germ unstable. So it kind of breaks down, if you will, okay? That's how it works. So it's not dependent on a growing germ because it can get into the germ covering and cause it to become unstable and break down, okay? So that's how we think it works. Now, methylene blue has to be compounded. And the reason it has to be compounded is it's only manufactured in an IV form because it's made for a different condition, okay? And the different condition that it's used to treat is a type of oxygen problem that some people have where their hemoglobin, that's the protein in the middle of red blood cells that's supposed to grab onto oxygen and carry it around your body. There are some people, the hemoglobin will not let go of the oxygen. Okay, we call that methemoglobinemia. And when that happens, you want to get the oxygen bumped off. And methylene blue does that. It causes the hemoglobin to release the oxygen. That's what it's made for, okay? But we can turn it into an oral form. There's some compounding pharmacies that do it around the country. And again, we think the way it's working is destabilizing the germ covering. Now, does that result in yeast overgrowth in the intestines? My experience is it has not been. But I'm still learning how to work with it. I mean, most of us have only been using this probably for a year, maybe a little bit more. But at this point, I do not see that it's leading to disruption of the good bacteria within the intestinal tract or within the urogenital system. Okay? All right. That's a lot of questions. Let me go ahead and do a quick screen share here. Oops. Hold on a minute here. It looks like I forgot to set up my screen share. Just bear with me here a minute, everyone. All right, let me try that again. Let's do a screen share here. All right, so this is my website, Treat Lyme by Marty Ross MD. In terms of how you can treat growing and persister forms of Bartonella, take a look in my infection treatment plan section here. Take a look at my article on how to get rid of Bartonella. I updated it in June of 20, basically to talk about the ways that I'm treating growing Bartonella and persister Bartonella. And I referenced Dr. Ying Zhang's work here as well, too. Okay? All right. All right, there you go. Good luck to you, Gail. Hello, Ken. Let's see. What is your latest view on getting a COVID vaccine as suffering from chronic Lyme? Thanks. So I am advocating that most people with chronic Lyme get the COVID vaccine. Okay. And I know when I was first asked this about 2 months ago, the anti-vaxxers came after me. And there are a group of anti-vaxxers in the Lyme world, but I just totally disagree with their viewpoint. So here's what the issue is with thinking about any vaccine, whether it's the COVID vaccine, whether it's the flu vaccine, whatever the vaccine is, you're weighing out risk and benefits, okay? So in the world of Lyme, you're weighing out the risk that if you get COVID, will you either die, as a lot of people can from COVID, or will you be left with permanent injury from having COVID? And is there a chance you can get COVID? All right. So right now there's a lot of COVID out there still. And people that get COVID are being left with chronic health problems. And some people with COVID are dying. Okay. So that's the risk of doing nothing. That's the risk of not getting vaccinated, is that you can get COVID. And, you know, the alternative to not getting vaccinated and preventing COVID is to make sure that all of us wear our mask when we go out so that we don't spread COVID. But we as Americans think we have a right not to wear a mask and infect everyone. So we're not good at that here in the United States. We've determined we have a greater right to spread germs than we have a right to protect our neighbor. That's my commentary. I know I'll probably get some comments about that too, but I think we should all be wearing our mask and doing the things we can to protect our neighbors from getting this horrible illness, but that's not what happens. So because that doesn't happen well in the United States, I think we're left with, yeah, we probably ought to get vaccinated. Okay. All right. Now, we have to weigh that risk of getting this terrible thing called COVID against the risk of something bad that can happen with the vaccines, okay? So I have not had a chance yet to look at the safety data on the new Johnson & Johnson vaccine that just got approved yesterday. So I'm going to confine my comments to what we know about the Moderna and the Pfizer vaccine at this point. So on both the Moderna and the Pfizer vaccine, before they actually approved those companies had to show 2 months of safety data. And the safety data looks good. So in the 2 months that they followed people, we did not see any major adverse consequences from that vaccine. I will tell you, in those studies, they didn't break out a group of people that had Lyme disease and follow them specifically, okay? And in fact, we have no way of even knowing from the research that was done on the safety of those, were there people that had Lyme disease in that, okay? But if I look at the safety data, it looks pretty good. If I look at the effectiveness data, the vaccine looks good, okay? So I have been recommending it, okay? Now, there is one group of people that I'm saying be cautious, and that would be if you are a person that has had a flu vaccine or other vaccines and has gotten really walloped hard to the point it may have taken you 2 months or so to recover from it, you may want to hold off on getting the vaccine and let herd immunity develop out in the community, okay? I will tell you that in terms of the vaccine, what I am seeing in my practice is that it does trigger a healthy immune reaction, which you want it to. I mean, you want it to trigger antibodies. You want it to teach your body to react against COVID, all right? So when you get the vaccine, especially after the first one, but more after the second one, there is a flare-up of cytokines that can happen. So many of you know in Lyme disease, the major reason you have symptoms in Lyme is that your immune system manufactures too many inflammation chemicals called cytokines. And anytime that you start killing Lyme germs, many people get herxes. And what that is the immune system manufactures even more cytokines after it sees these dead germs. Okay. All right. So that's what a herx is. Okay. So when you get the COVID vaccine, it can trigger some increased cytokines. That's temporary. But people, especially after the second vaccine for the Moderna and the Pfizer, seem to be getting some fairly strong cytokine reactions where they'll have fatigue. They may even get a temperature. They may have body aches, and it can sometimes take a week or more to resolve. Is that a reason to not get it as a person with Lyme? No. You may have a flare-up. I mean, you may get worse because of the cytokine symptoms. But again, there's a greater risk of harm from getting the COVID, especially here in the United States, where we think we have a right not to wear a mask and infect our neighbors, okay? So I am actually for people getting the vaccine, and I have been advising that in my practice as well, too. All right? Okay. Thanks for the question, Ken. Hello, Sue. Let's see. I have been treated for Lyme and co-infections for years, was just diagnosed with AFib. How do I know if it is Lyme related? And if so, what is the proper treatment? Many thanks for all you do for us. So I tend not to think of atrial fibrillation as being caused by Lyme. I do tend to think of some other heart conduction problems where you have blockage of electrical transmission in the heart. They're called heart blocks. I do think of that as being caused, but I don't tend to think of atrial fibrillation as being caused by Lyme. So I would treat it as you would treat anyone with atrial fibrillation. Your heart doctors should be figuring out what medication they can give you to keep that from happening. And they may even want to put you, if something that happens on a regular basis, they may want to put you on some blood thinners to make sure that your heart doesn't develop blood clots that during fibrillation that break away and go up into your brain. Okay. So those are my thoughts on that. Okay. All right, Sue. Thank you. Good luck to you. Hello, Robert. Let's see. Hi, Dr. Ross. Thanks for all your help. I was happy to see on your supplement site that you carry Biocide Dentalcidin. Would you carry the Dentalcidin oral rinse also at some point? It's a good question. I can look into that. I haven't. I need to go back and see what they've added to their product line. I haven't updated. I try to carry all their products, but I guess I haven't. I missed that one. So yes, Robert, I can look at that and see about carrying it. In fact, I can look into it at my next order, which would be in about a week. Okay. All right. And actually, let me write that down here for a minute. But thank you for that. Let's see. Hold on here a minute. All right, let's see. Next question is from Anna. Hello, Anna. Let's see. Dr. Ross, thank you for the webinars and answers. You're welcome. Let's see. Topic: Lyme disease with Babesia and renal insufficiency with a high creatinine and low EGFR on blood test. Do you have this kind of problem emerging in your patients on oral antibiotics? And what course of action do you usually take? Is it possible to continue the antibiotic treatment? If yes, in what form? Pulsing? Does one need to stop the antibiotic regimen in order to perform the detox? Okay, so when somebody develops increased creatinine, which is a sign of having your kidneys are not working as well, we have to look at what the antibiotics are that you are on and try to remove those that have the greater likelihood of causing that, okay? So in the various antibiotics we use, those that can possibly lead to kidney problems are the sulfa antibiotics like Bactrim. The other family that has some tendency to do that would be the tetracyclines like doxycycline and monocycline, okay? Those would be the other ones. And rarely, not as great of a chance as those would be the macrolides, which would be the azithromycin biaxin. Those are also partly removed by the liver and tend not to give kidney problems as much. Now, Malarone, which is an antibiotic that we can use to treat Babesia as well too, I tend to think as being more cleared by the liver. Mepron tends to be more cleared by the liver, and we should be able to use those, okay? So, Anna, I don't have the advantage of asking you what exactly have you been on, but typically it's just a matter of looking at the antibiotics and removing the ones that you've had that could be leading to the kidney inflammation and replacing them with ones that typically don't have as great of a chance of doing that. And your healthcare provider should be able to do that, okay? All right. Thanks for that question, Anna. Hello, Kathy. Hello, Dr. Ross. I've been getting optical migraines since being diagnosed with Borrelia and Bartonella. My ophthalmologist has not made any connection between Lyme and eye issues. Have you? I also have increased intraocular pressure in one eye. Thank you. So I don't think of increased pressure in an eye as coming from tick-borne illnesses, okay? So the one thing we have to be careful about, and it's a good question you raise here. The one comment I would make is we have to be careful in Lyme disease that we don't that we look for other things that can cause a problem in addition to Lyme, because just because you have Lyme does not mean it's the cause of all your problems. Okay, it's easy to think that because Lyme causes so many problems, but Lyme is not always the cause of every problem. Okay, so in my experience, I have not seen intraocular pressure being related to Lyme. Okay, in terms of migraines, of the various infections that I think of as triggering migraines, Babesia can. I have seen Borrelia and Bartonella also do it. They can be the cause of it, and often as you get them under control, you can get the migraines under control, okay? Other things to get the migraines under control would be to do standard medications like Imitrex to break a migraine as it's starting to happen. There's medicines we can use to prevent migraines herbally. I like working with something called Butterbur. I'll show you how you can find that here in a minute, but it's called Butterbur. It's a 50 milligram pill. If you take it 3 times a day and you take it all the time, even on days you're not having migraines, it can do a pretty good job preventing migraines. It can take about 2 weeks to a month for it to fully kick in. It works as well on studies as prescription medications that can prevent migraines. The other common medications we use that can prevent migraines are either calcium channel blockers, which are a group of blood pressure medicines, beta blocker blood pressure medicines, and some antidepressant medicines sometimes can help, and also anti-seizure medicines like Topamax that you would take daily can also help too. But the butterbur is a nice way to prevent it as well too. Let me do a quick screen share and I'll show you that product. Okay, so this is Marty Ross MD supplements. This is where my patients get their supplements, but anyone can get supplements here. If you're wondering what high quality supplements do I recommend, you can take a look here. And if you like what you see, you could order from us. If you are interested, keep in mind, I don't charge shipping on anything over $50, and we take care of the state taxes for you. You don't have to pay taxes when you purchase from us, okay? And I ship out of Austin, Texas. And now that we're beyond last week, things are moving again. Last week was a little rough down there, but things get out of Austin to most places in the country pretty quickly. Okay. All right. So let me show you what you want to look at here. It's called Petidolax, is my butterbur product. There it is. So it's an integrative therapeutics product. And again, it's called butterbur, okay? And you would want to do 50 milligrams 3 times a day on this one, okay? All right. All right. Thanks for that question, Kathy. Good luck to you. Hello, Erica. Let's see. I currently have Lyme and Babesia. Just found out I have mold toxicity as well. Mycotox urine testing showed I have an abnormally large amount of the toxin ochratoxin A. I was told to take activated charcoal and chlorella to help address the mold toxicity. Should I be taking anything else? I'm unable to find the source of the mold in my home, even though I'm treating the mold in my body. Why continue to be sick if I can't find the source? Okay, so so everyone, and some of you know this, but and Erica, you may know some of what I'm about ready to say too. But in terms of mold toxicity, let me just describe what the problem is. So there are 25% of all people that have a genetic predisposition that makes it so that their immune system will not remove mold toxins once you breathe them in and they get into your bloodstream. Okay. So, and so what happens in this situation, what's supposed to happen, and this is what happens in 75% of people that don't have the problem, is that if you breathe in a mold toxin in an area where you've been, and that mold toxin gets into your bloodstream, and when everything is working correctly, some of your immune cells will come in and tag that mold toxin, and then other types of immune cells will come in and break that mold toxin down. Okay, that's what's supposed to happen. But in 25% of people, the immune system is not set up correctly to tag those mold toxins, so they don't get tagged. And when they don't get tagged, they then go to the liver, and the liver is supposed to handle them because the liver is what's supposed to clean out fat-based toxins, but the liver doesn't do a good job. And so they're moved from the liver. They go into the liver as a fat-based toxin. They come out still as a fat-based toxin. And they go out into the intestines, and in the intestines, they get reabsorbed again. So you just get this endless loop, okay? All right. So the treatment, part of the treatment is grab hold of them out in the intestines to pull them out of your body using what we call binders, okay? And for the ochratoxin, a good binder is charcoal. The chlorella, to be honest, may or may not help, but your main binder is going to be the charcoal. Okay, so yes, bind them up to get them out. Okay. Second thing that can sometimes help okay, so that's the main thing. Okay, you want to make sure you're having bowel movements too, because you got to poop this stuff out after it's been bound. Okay, so if you tend towards constipation, make sure you're trying to have regular bowel movements at least once a day. And to do that, you could add magnesium at nighttime. You can do magnesium citrate or magnesium malate or magnesium glycinate, any of those. Take up to about 600 milligrams at night. Often that can be useful to loosen your bowels up. If that's not loosening it up, you can even take vitamin C, working all the way up to 10,000 milligrams or 10 grams, which is 10 grams one time a day. You can do that along with magnesium. And often in most people, that's going to be enough to get you having regular bowel movements. Not in everyone, but in most people. Okay. All right. Now, in terms of where could you have gotten this? So whenever I do have somebody that comes back with elevated mold toxins, I will ask them to get a home mold inspection, because I want to make sure that they're not living in an environment that is putting the mold toxins back into them. Now, that does not mean that everyone that has mold toxins in them got them from their home environment, all right, or in your current home. So remember, these are things that get in your blood when you've breathed them in whenever you've been in a mold environment. So maybe they got trapped in you from a home you were in 15 years ago, all right? Maybe they got trapped in you when you went to church in an old church building. Maybe they got trapped in you when you went to the grocery store in an old building that had mold in the walls that they didn't know about, okay? So we can only control our home environment, but it is possible that you get these mold toxins in other environments, okay? All right, now, in terms of mold toxins, there's one other tricky thing that can happen sometimes. So when we've been in mold environments, a very small percentage of people not only inhale the mold toxins that get trapped in them, sometimes they can breathe in the spores of those mold, and the mold spores get lodged either in their sinuses, not the sinus passages, but the sinuses, okay, or get into your intestinal tract, and you can become colonized with this stuff. And if you become colonized with mold, you become your own mold toxin brew pub. You keep producing them yourself. And that gets tricky. The trouble is, we don't have a good test to see if you're colonized. We have to figure out if you might be colonized based on how you respond to treatment. So if you're on mold binders and you're taking them at least 2 times, maybe even sometimes 3 times a day, and we go back in and we recheck you in 3 and even in 6 months, and we're making no headway at all, and if your house is clean and you're doing a pretty good job of not going out into other environments that can be exposing you to mold toxins, we then have to start wondering, are you a person that is colonized, that you've become your own mold toxin brew pub, okay? And in those kind of situations, then we got to start giving you things to kill the mold. Not just remove the toxins, but actually kill the mold that might be living in your sinuses and might be living in your GI tract, producing those toxins, okay? So I just will throw that out to you. Those are different stages to think of in terms of how you manage the illness. But no, if you haven't found it in your home, it might not be that you got it in your current home. You might have gotten it elsewhere, okay? All right. Good luck to you, Erica. Hello, Marta. Let's see. Hi, Dr. Ross. Thank you for doing these webinars. You're welcome. Let's see. I've just been diagnosed with chronic Lyme disease. The LMD I saw told me my testing MDL labs was CDC positive for Lyme and tularemia. I also have active West Nile virus. She prescribed doxy pills and ivermectin as well as L-lysine. Do you think this is the best way to start treatment? I have had the same symptoms for several years: chronic pain, electricity feeling in my body, increasing vision issues for the past 6 years, and steady increasing memory issues and severe brain fog, especially the past year, my main concern. Also, would pulsing be appropriate at this juncture? Okay, so first of all, in terms of the Lyme infection, the doxycycline is a good choice. It's an antibiotic that can kill Lyme. The ivermectin is not something I use to treat Lyme, and there is no laboratory evidence that shows it can treat Lyme. I know some of my colleagues are starting to use it, and suddenly ivermectin and Parasites has become one of the issues of this season. Suddenly everyone is talking about ivermectin to treat Lyme and ivermectin to treat parasites. But the truth is, most people don't have parasite problems. And ivermectin, there is no laboratory evidence that it can treat on Lyme. I wouldn't use it to treat Lyme. I'm not familiar enough with whether ivermectin can treat tularemia. I would have to look into that. It isn't something I have used before, but I can't say for sure. Okay. Ivermectin has been shown to be useful against COVID. The data is kind of questionable, but there's some evidence it might. And ivermectin is effective against certain parasites that live in your intestinal tract. I'm not clear if it's effective against tularemia. Okay. So is the doxy a good idea? Yeah. In terms of other parts that you need to build into a treatment, I would need to know more. I appreciate you listed out a lot of your symptoms, but I would need to know more about your other symptoms to help figure out clinically, do I think you also have Babesia or Bartonella, even if your testing is negative? Sometimes you can actually have those infections, and we make a decision based upon what your symptoms tell us. The West Nile virus being active, what that probably means is that you have elevated antibodies against West Nile virus, which doesn't necessarily mean it's active. It means you have elevated antibodies against West Nile virus. So let me talk about that real quick. So when you get virus infections, your immune system will make antibodies. And the antibodies that it will make when you first get sick are a family called IgM antibodies. And then eventually they get replaced and your immune system starts making IgG antibodies. Once you make IgG antibodies, they're the memory of the immune system. And your immune system will keep making those IgG antibodies even if the germ is out of you and under control. So if your practitioner is saying you have West Nile virus because you have elevated antibodies, it could be an old infection that your immune system already dealt with. All right. So you need to kind of question your practitioner a little bit more about that as to why are they making a decision based on elevated antibodies that you have the infection. The elevated antibodies may just mean your immune system is doing a great job, got turned on, and that there is no longer a problem too. Okay. For me to give you the best advice about what would be the way to handle your situation, I would need to ask you a lot of questions about symptoms beyond what you've told me here. And the way to do that would be to set up a consult visit with me if you want to do that, okay? But again, I know a number of my colleagues are starting to use ivermectin to treat the Lyme germ. I'm not clear what evidence there is that shows it works. I think it's become a new fad treatment among patients and among practitioners, but there is no scientific evidence that shows that it is useful for the Lyme germ. All right. There is evidence it can help parasites in your intestines, and there is evidence that it can help with COVID, but it is not something that I would use to treat the Lyme germ. Again, I think it's become a fad treatment of the season, basically. Those are my opinions on that. Okay. All right. So in terms of figuring out whether you have Bartonella and Babesia, and let me go ahead and do a quick screen share for you here. All right, so my website, okay, if you're trying to figure out, so the big infections that people usually get are going to be Lyme, Bartonella, and Babesia. Those are the big ones, okay? And even if you have negative testing for Bartonella or Babesia, you could have the infections because the testing is not perfect. So you've got to look at what your symptoms tell you, okay? So take a look at this how to diagnose section here. And I have an article about how to diagnose Bartonella where I list out a lot of the symptoms. And if you have a number of these symptoms, you probably should treat for Bartonella. And I have a similar article on how to diagnose Babesia. And again, if you have a number of the Babesia symptoms, you want to treat for Babesia, even if the testing is negative on that too, okay? Now, one thing I will tell you about Bartonella, so if your provider did MDL testing, MDL, I believe with their Bartonella test, looks to see if you have antibodies against either 1 or 2 strains of Bartonella. But we actually recognize there are 28 strains of Bartonella, of which 15 of those can infect humans, okay? So you can already see the problem with Bartonella testing if you've done the MDL lab. It doesn't test against enough strains. The lab that I like to use these days to test for Bartonella is IGenex out in California, has come up with a Western blot panel where they're looking to see if you have antibodies against 4 specific strains in those 15. And in addition, the whole family of Bartonella that includes all of the 15, okay? That probably is your better lab test to see if you have Bartonella these days. It has, in terms of validation studies at IGenex, it has the ability to pick up about 90% of Bartonella cases, okay? All right. Thanks for that question, Marta. Oh, one other thing I should show you. If you do want more input from me, let me just show you how you could do that. All right, so, okay. So take a look, click on this clinic link up at the top of my site. And that'll bring you over to my clinic website. And then look under this appointments page. And there are 2 ways to see me. Both of these are via telemedicine. One is my full medical service visit. The other one is my limited consult service. To know more about the difference, including what the cost is of these, read the full sections down here, okay? And see if one of these might appeal to you, okay? I'm trying to get you to actually read all the section down here, because down here is every piece of information you probably need. If you can't find it there, then hit my frequently asked question page, where I do review various things about my practice as well too, okay? All right, let's see here. Thank you for that question, Marta. Good luck to you. Hello, Papa. Let's see. Hello, Dr. Ross. We are from Czechia and have a 14-month-old son with autism who was a very happy and communicative child until October. In September and October, he became sometimes tired, and in early November, he suddenly developed a number of symptoms like OCD, irritability. He also stopped communicating verbally, some tics, depression, etc. is corresponding to a PAN syndrome. That is what I was thinking was possible PAN syndrome. Our pediatrician tested him for various infections, which confirmed the onset of Lyme disease, probably in the summer. 3 weeks ago, we started treatment with a combination of 3 antibiotics. We ought to ask what you would recommend to us to reduce inflammation of his brain. So far, we are giving our son ibuprofen, vitamin D3, quercetin, and liposomal curcumin. Our son's weight is about 120 pounds. Okay, so the big things I like here that you already are doing, you're doing some good things, is the quercetin as well as the curcumin are useful at decreasing inflammation from infection, okay? And they're probably even better than, or at least infection from tick-borne illness. Now, the ibuprofen is good at reducing inflammation from the strep bacteria that you can sometimes see in PANS, okay? So I think those are all good choices. In terms of the quercetin dosing, I usually, for somebody of 120-pound, either child or adult, I would wind up using 200, I would use a 250 well, actually, I would do 500 milligrams taken 3 times a day, okay? So 500 milligrams taken 3 times a day. And for the curcumin, given that he is I think you're saying 120 pounds here, that's the way I'm reading it, I would do it as 500 milligrams 3 times a day as well. And if that doesn't seem to be helpful enough, you could even go up to 1,000 milligrams 3 times a day. Those are the kind of doses I would use if he was a patient of mine, okay? Now, you may want to talk to his pediatrician about this to make sure they're comfortable with it, because they're his doctor technically, okay? They know what's going on. But if I had somebody in a situation, that's how I would wind up using those, okay? All right. Good luck with your son. Hello, Duval. Let's see. Dr. Ross, would you please discuss the pain related and the illness associated with Lyme? Do we push through the pain and continue to exercise to tolerance, or do we exercise only to tolerance? What do our knees look like that are affected with Lyme? Do any injections help the knees? Can we return our knees to total health? Okay. So Duval, I have a rule of thumb, which is with Lyme, you exercise to tolerance. Now you use that word. Let me explain what I mean by tolerance, okay? So I tell my patients that exercise can be good. And when you first start doing it, maybe you can only do a minute. Maybe you can only do 5 minutes, okay? By trial and error, you find a level that you can do with whatever kind of exercise you'd like to do that doesn't flare you up the next day, okay? So it's not today that the issue is, it's the next day, okay? So if the next day, the level of exercise you did today leaves you with a lot more pain, or it leaves you with a lot greater fatigue, it means you did too much. And by trial and error, you should be able to figure out what your tolerance is. Now, it could mean walking for a minute. That may be all you're able to do to start with, okay? All right. In terms of your knees and knee pain, so sometimes the knee pain is inflammatory. It's just inflammation in the knee without any destruction to the knee or any change to the architecture in the knee, okay? But at other times, Lyme may lead to some injury of the internal structures of the knee, specifically the cartilage. So your knee is basically where two bones come together. Those bones, so the top, your leg bone and your leg bone, when they come together and meet to create the knee, the surfaces of those bones are covered in cartilage, okay? And that's the structure of any joint. Wherever two bones come together in the body, the surfaces of those bones are covered in cartilage. Now, cartilage has two functions. Number one, it's softer than the bone, so it acts like a shock absorber, okay? Second thing that it does is it is smooth, so it allows your bones to glide over each other easily, okay? Now, as I said, it's softer than bone. So in some people that don't have Lyme, sometimes that cartilage will wear down and they wind up getting bone rubbing on bone, and that leads to arthritis, okay? What happens in Lyme is sometimes the bacteria, the Lyme bacteria, will burrow into the cartilage. It will release enzymes that destroy the cartilage or break the cartilage down, because what Lyme's trying to do is it likes to get into tissues that don't have good blood flow so that it can get away from blood that has oxygen that can kill it, okay? So sometimes when Lyme's trying to hide in us, it can break down the cartilage, all right? So in that case, you could have, you wind up getting broken down cartilage, you wind up getting bone rubbing on bone. That causes inflammation in the bone, and sometimes the bone will develop bone spurs then, okay? Now, what I'll try to do is treat for my patients for their knee pain by actually getting the germs under control. And in addition, by trying to control inflammation by using like a quercetin or a curcumin that I was just talking about in the previous question, okay? But let's say we're about 6 months or so into treatment and that knee pain is not getting any better. Then what I'm going to start doing is to take some steps to try to rebuild the cartilage. And what I'd like to use to rebuild cartilage in my practice is to use glucosamine sulfate. Glucosamine sulfate is a building block. It's one of the bricks, if you will, of cartilage. And if we give more to you, it can help rebuild cartilage, okay? Now, it works about 80% of the time. It doesn't work in everyone. And you would use a dose that is 500 milligrams 3 times a day. If you are going to give glucosamine sulfate a try, don't buy garbage, all right? You want to make sure you're using something that has a good chance of helping, okay? So the problem with supplements, and many of you may be familiar with this, is that a lot of the stuff that's out there, like at Target and Walmart and places like that, basically has been shown not to often carry what they say is in the product, and they might even have other additives in them that aren't even on the label. And I'm saying that based upon research that was done by the New York Attorney General, where they went into Target, I believe, and I believe they went into Walmart, pulled a bunch of products off the shelf, or actually GNC, I believe, pulled products off the shelf and did genetic testing to find out was what was said on the label actually in the product, and were there any other things in the product that weren't on the label. And it was quite high. It's like 40% of the time, all the ingredients that were supposed to be there were not. And about 40% of the time, additional agents were in there too, okay? So you got to be careful in the world of supplements. If you're going to try to see if something's going to work, that you choose a good product, all right? So how do you do that? Well, take a look at my supplement store. Those products I have vetted by working with the various manufacturers, and I've chosen ones that have evidence that what's in there is in there, okay? And also ones that I have worked with in my practice long enough to know that they actually work, okay? So in terms of the product that I like for the glucosamine sulfate, I like a Thorne product. It's a 500 milligram pill, and you would do it 3 times a day. So I would, if you're going to see if this is going to work, make sure you're choosing a good product, okay? So 500 milligrams 3 times a day, and you want to give it a try for at least 2 months to see if it's going to work. If by 2 months it's not giving you much relief, then I would go ahead and stop it, okay? All right, so let me just do a quick screen share here. All right, so this is, again, as you know, this is my my supplement store, okay? And in terms of the glucosamine, the product you would want is this product by Thorne, okay? And again, I just trust Thorne products to have good ingredients. Also, the good thing about Thorne is they tend not to put a lot of artificial fillers in here that could harm a person with Lyme as well, too, okay? All right. All right. Duval, thanks for the question. Hello, Brandy. Let's see. Should you pull a blackened tooth that has no filling? The dentistry part of these infections is confusing on whether to do root canals or not, or have teeth extracted or not. Just because a tooth is black does not, to me, would not necessarily mean that you need to pull it. What I like doing, Brandy, with these kind of tooth questions, because I'm not a dentist, okay? I want to be very clear about that. The issue with Lyme that we worry about is that you can get pockets of infection under teeth, okay? And there are certain dentists that are set up better to look and see if that could be happening. They tend to be known as biologic dentists. And there's certain types of x-rays that they can do in their offices where they can see if you have potential pockets under the teeth that might be infected. So I would try to see if you can find somebody that's a biologic dentist that might be able to help you figure out whether that tooth is at risk of having infection under it or not. Okay? All right. Good luck to you. Hello, Monica. Let's see. Dr. Mozignani says in his webinar that azithromycin is not, I think, ineffective in the treatment of Bartonella than Monica, I'm not understanding your question because he said in his webinar that azithromycin is into effective in the treatment of Bartonella than azithromycin. I'm not sure what you're saying there. What I can tell you about azithromycin is that the studies out of Johns Hopkins show that it is effective on Petri dish experiments. I can tell you clinically, I have found it to be effective too. There is another family member of azithromycin, which is called clarithromycin, that was not researched in the Hopkins studies, but that I will use as a substitute for azithromycin. And I do find it effective in my practice, okay? But I usually find it effective if I'm combining it with other antibiotics as well, too. So Dr. Mozignani has his experience. I have my experience. But I don't understand what you were asking with your question because you used the same antibiotic name twice, okay? All right. Thank you for that question. And maybe you have some clarification further on as I get into this. All right. Hello, LM. What is your experience with Alinia? My experience with Alinia is it's expensive. That's one of my experiences with it. Okay. So Alinia, everyone, is a drug that was first designed to treat anaerobic parasites. These are parasites that don't need oxygen. And it was specifically designed to treat people with intestinal parasitic infections. Okay. All right. And it's shown to work in those kind of situations. Now, in the world of Lyme disease, some of my colleagues had decided that based on how it works, the mechanism by which it works on anaerobic parasites, is possible that it might work on the Lyme germs, because Lyme germ is also anaerobic too. And so there is a possibility it could help with Lyme based on the mechanism by which it works, okay? Some of my colleagues also, because it was designed to treat Babesia, or a parasite, and Babesia is a parasite that lives in the red blood cells, have tried it for Babesia as well too. Now, Babesia is not an anaerobic germ. It lives in our red blood cells that have oxygen in them. So I'm not clear that Alinia would actually work against it. I have tried it, though, to see. And my experience in working with it as an agent to treat Babesia is it's not that good. I don't use it as part of my Babesia treatments anymore. I had initially tried it on the Lyme germ under the idea that it could treat anaerobic bacteria like Lyme. And I'm disappointed by it. I think there's better agents that you can use that do not cost as much. So I'm not saying it won't work, but I don't find it to be the most effective, and I find it to be too costly, to be honest with you. Okay? All right. So the other thing, I will sometimes use it if I've got somebody who I think has intestinal parasites. I will use it as a means of treating that. I am not a believer that other than Babesia, a blood parasite, I am not a big believer in the current fad where many people are starting to treat for parasites that they think are located everywhere in their body. I think that has become a fad. I think it's a fad that has been perpetuated by Dr. Klinghardt out here, who thinks that parasites live throughout our body and are causing people to be sick. I do agree there are parasites in the intestines that can get in the way here. I don't agree that we should be using ivermectin, Alinia, and all these other anti-parasites to treat parasites that people postulate may be living deep in our tissues throughout the body. There is no evidence of that at all. And I think that's a current fad, and I'm starting to see it because I'm seeing a lot of people asking about that. But so I would not agree with treating for systemic parasites, if you will. I do, having said that, I recognize that Babesia is a parasite that does get in your blood and go throughout the body, but we would use anti-malarial drugs to treat that. Okay? All right. Thanks for that question, Ellen. All right. Let's see. Hello, Joyce. Say hi, Dr. Ross. I have had Lyme and co-infections for 20 years, bitten twice, 10 years apart. First bite on the back of left armpit, 1 month on doxy, second bite on back of right armpit, no meds. In 2016, I had a major flare and started herbal therapy for the past 5 years. A few years ago, I started having muscle issues, including pain and weakness, especially in my shoulders and upper arms. I have tried everything you suggest: glutathione, curcumin, ATP360, Cytoquel, an array of vitamins, plus a multi-mineral supplement. I'm going to see a new primary care doctor in 2 weeks. I can't find a decent LMD here in Phoenix, and would like all appropriate blood work done. Aside from magnesium and creatinine, what do you suggest? The pain now is affecting my daily life. Thank you for sharing your knowledge and for your calming demeanor. I look forward to learning from you with each webinar. Joyce, you're welcome. Joyce, I would, from what you've described, I would want to know if you have active Lyme still, to be quite honest with you. And although you're doing some good things to support your body, ultimately you may need to use some prescription antibiotics to treat your germs. In terms of germs that could be giving this kind of a complex of symptoms, I would wonder about Lyme. I would also wonder possibly about Bartonella from what you've described here too. So you might want to see if you actually have those infections still. And you might want to see if your doctor would help you organize an IGenex test. You could actually order an IGenex test kit yourself to be sent to you. And you would want, in terms of bring it to the doctor and circle the test you want to have done and see if they'll sign off on it. So for the Lyme, I like to use a test called a Lyme immunoblot, and that is test 325 and test 335, okay? For Bartonella, I like using the Bartonella Western blot through IGenex, and that is test number 351 and test number 352, which looks to see if you have IgM and IgG antibodies. That test will find Bartonella if it's there about 90% of the time. And you might want to see if you can bring the test kit with you and say, I'm wondering if I got active Lyme and I'm wondering if I got active Bartonella. Things aren't getting better. I'm considering whether I might try to find a doctor to use antibiotics with me, but I want to get testing first. Okay, that might be what you want to do. The other thing is you may need to find a doctor who can start prescribing antibiotics for you if the herbal options have not been giving you any benefit to date, okay? All right. Good luck to you, Joyce. Hello, Lawrence. Let's see, are there any concerns with getting a COVID shot and taking antibiotics like azithromycin and cefuroxime for Lyme? Pharmacists seem to think they work at cross purposes. Can I get a second COVID shot while on those meds? I see no problem in being on those antibiotics and getting the COVID vaccine. They're not going to have any impact on what's happening with the COVID vaccine. You'd be okay doing that. Hello, Lynn. Let's see. Hi, and thanks for your webinar. You're welcome. Have you seen any pattern with adverse reactions to the COVID mRNA vaccines in your Lyme patients similar to issues with flu vaccine? Do you see severe reactions more or less? So, Lynn, what I have been saying, I tried to describe this earlier tonight too. I am seeing that people get a cytokine flare, especially after the second vaccine. And that cytokine flare can give more body pain, sometimes a temperature, sometimes muscle achiness, but it seems to resolve within a week or two in most of my Lyme patients. And I think it's not a reason to not get the vaccine, okay? All right. I will also tell you that seems to be happening in people that don't have Lyme either. So for instance, I had my first mRNA vaccine about 4 weeks ago. I go to get my second one on Sunday. That's when I'm scheduled to do it here. And I have blocked out some time in my schedule early next week so that I'm not seeing patients, so that I have a chance to deal with a flare that I might get, and I don't even have Lyme. So I'm anticipating having some cytokine flare, given how I responded to the first vaccine, which was with a small cytokine flare then too. Okay? All right. Thanks for the question. Hello, Pavel. Let's see. I would like to ask if the combination of otoba bark extract and cat's claw is also effective in the treatment of Lyme disease in Europe. Thank you very much. Pavel, what I have been seeing, so everyone, my favorite two herbal antibiotics to treat Lyme is to use a combination of cat's claw and otoba bark. I came up with the idea to do that based on Petri dish experiments that got published probably about 10 years ago now. Through a lab in New Haven, Connecticut, run by Eva Shoppy. She's doing some very interesting Lyme research. But at that time, she looked at those two and saw that they had the ability to kill both spirochete and cyst Lyme. And she also showed that they could remove biofilm slime layers that cover germs. And when you put the two together in her experiments, there was a whopping kill. You actually got a greater kill than you might expect if you just added up the individual kill potential of each of them. So it's good stuff, okay? What I see clinically in my practice is that they seem to help about 85 to 90% of people to get well. It's pretty good, okay? In fact, I give it the same chance of helping somebody as prescription antibiotics. Now, in my practice, in terms of people that I have given advice that are in Europe versus in the US, I see that it works just as well against European Lyme as it would against strains of Lyme that we have here in the States. And in fact, some of those European strains are now setting up out on the East Coast, like the Atrial strain, for instance, is becoming one of the larger strains out of the East Coast here in the United States. And I don't see any, and Guarini, the other one that is also European strain, both of those are now out on our East Coast here in the States. And I find that my East Coast patients do just as well on otoba and cat's claw as what patients do out here on the West Coast of the United States, okay? So yeah, I think it works well against European strains, okay? All right, good luck to you. Hello, Kathleen. Let's see. Hello, Dr. Ross. Thank you so much for hosting this webinar. You're welcome. Thank you for saying so. It looks like Robin has said hi there. Hi, Robin. I'm not going to post that. Hello, Christine. Let's see. Hello, Dr. Ross. I had 3 tick bites with bullseye rash. Western blot is positive, but Bartonella test is negative. I have chronic fatigue, poor sleep, anxiety, hormonal imbalances, stomach and gut bloating, nausea, weight gain, knee cartilage erosion, Tarlov cyst, gallstone, and high HDL levels, low cortisone, difficulty on focusing and being sharp, lack of motivation, occasional blurry vision, headache, muscle twitching, back pain. Can I also have Bartonella, not just Borrelia? So the answer is yes, you could. The things that would make me think of Bartonella from this list that you just gave me would be ongoing anxiety and cognitive dysfunction can sometimes be seen in Bartonella, especially the lack of focus too. Other symptoms that could make you think of Bartonella would be pain on the balls of the feet. Often people that have more extreme psychiatric issues of anxiety, depression. Sometimes people with Bartonella will have a feeling of internal vibrating or buzzing. Sometimes people with Bartonella have a lot of neuropathies, like loss of feeling or nerve pain, sharp shooting, stabbing, burning, piercing type electrical pains. Sometimes Bartonella will give external tremors or seizure-like episodes as well too. So the answer is you might. There's 2 ways to go. One is when they're designing their antibiotic approach for your Lyme, they might consider using antibiotics that treat both Lyme and Bartonella at the same time. So for instance, using a combination of doxycycline with rifampin or minocycline with rifampin or azithromycin with rifampin or clarithromycin with rifampin can effectively treat the Lyme germ and treat the Bartonella, okay? Those are some ways that I would handle this in my practice. Or what you could do is get more advanced testing to see if you have Bartonella. And I think the most advanced test that can look more broadly to see if you have any one of the 15 strains that can infect people, the one that probably has the most chance of being accurate and effective would be the IGenex Western blot test. Now, I know Galaxy Labs is doing a PCR, which is a DNA test to see if you have Bartonella in you. The difficulty with that test is that the germs need to be in the blood that you draw. All right, Bartonella doesn't always readily live in the blood, so the chances of finding it there may not be perfect. Galaxy has never been able to determine what is the sensitivity of their test. That sensitivity means what's your ability to find an infection if it's in a person. And they've never done any standardization tests to tell us how good are they at finding Bartonella in you if it's in you. And what I would suggest is, because Bartonella is not always in the blood that swims by the needle when you're drawing it, that you might have a hard time finding it with their DNA PCR test versus the IGenex test, because it's measuring antibodies. Antibodies are there all the time, all right? If you've made them, they're going to be in the blood, even if Bartonella isn't necessarily living in the blood. So the IGenex test probably is a little bit more sensitive at finding if Bartonella is in you, okay? All right. Thanks for that question, Christine. Oh, again, the Bartonella test that I mentioned earlier, the Western blot that I gave you the numbers in the last question, is the Bartonella test I'm talking about, okay? The Bartonella Western blot test for IgM and IgG antibodies done through IGenex, okay? All right. Hello, Brenda. Let's see, have you used azlocillin? Oh, we already answered that one earlier. Hello, Robin. Let's see, new to this. Do we type? Oh, yeah. I think you're seeing how this works. Hello, Thomas. Let's see, mildly low anion gap and mildly low sodium. Have you seen this before and any suggestions? Also, what infection can cause an occasional bleeding nostril, staph, etc.? Thank you. So with occasional bleeding nostrils, I tend not to think of infection. I tend to think of tissues, the nose tissues about right here, up along your septum. This piece of the nose is a septum. Right about this spot along the septum is an area that has a lot of blood vessels right underneath the skin. And if people have allergies where they have runny noses, or they have colds, or they're in an area with a lot of dry air, what can happen is this area can dry out, the skin can dry out and can crack, and you get bloody noses from that. That is 99% of the time why somebody has a bloody nose, okay? The solution for that is to try dabbing about twice a day some Vaseline up into this area, so right up in there, to see if you can get it so that area stays moisturized and the skin doesn't crack as much, okay? In terms of mildly low sodium, that's a whole complicated evaluation. First, I would start by re-looking at the blood to make sure it was accurate. If it is still low, then your provider needs to go through some blood testing to see what the concentration is of your blood and the concentration is of your urine, because you got to decide whether you've got a problem where you're dehydrated. There's a whole bunch of other stuff that is beyond this webinar, but your provider should know how to work that up if it stays there. Okay? All right. Good luck to you, Thomas. Hello, Maria. Let's see. My son, 11, was diagnosed with Babesia and Bartonella, but negative for Lyme. How can he test negative for Lyme having these co-infections? So, first of all, it is possible to get Babesia and Bartonella and not get Lyme. It can happen. So ticks that transmit Bartonella and transmit Babesia can get them and not necessarily carry Lyme. Okay, that's possible. Also, Babesia can be spread by mosquitoes. Bartonella can be spread by mites and fleas and other vectors, so maybe it had nothing to do with the tick, okay? Also, you have to question whether the testing did not find the Lyme and that Lyme could still be there, because testing is not perfect for Lyme. I don't know what test you had done for the Lyme, but various tests have various abilities to find Lyme, and even the best test, which I would say these days is the immunoblot from IGenex that can identify Lyme if you have it in you about 95% of the time. It'll still miss it about 5% of the time. So sometimes when it comes to Lyme, we have to use clinical judgment. If we see somebody that has infections that could be tick-borne, like Babesia and Bartonella, and then you have to wonder, could Lyme be there? And if there are enough symptoms that suggest Lyme, I would still cover for Lyme, even if the testing was negative. That's what I would do in my practice, okay? All right. Thanks for the question. It's a good question. Hello, Kate. Let's see. Thank you, Dr. Ross, for helping us. You're welcome. Question: can mold toxicity or Lyme and company cause elevated ANA, not full-blown autoimmune disease, just this marker for 5 years already? And if yes, have you seen it resolved after treating mold and Lyme? I am positive for Lyme and co-infections and mycotoxin urine test. Okay, so I do not see typically that mycotoxins, mold toxin illness, can lead to elevated anti-nuclear antibody, which is what ANA stands for. ANA means anti-nuclear antibody, okay? So nuclear means genetic material. And so suddenly your body can start making antibodies against your own genetic material, all right? Now, what I will tell you is it's nonspecific. When you get an elevated ANA, it can sometimes be seen in autoimmune illnesses, but infections like Lyme can trigger it to be elevated as well too. So yeah, it could be coming from the Lyme. It may have not, in other words, your immune system in reacting to Lyme is also making antibodies against you, triggered by Lyme, basically, okay? And the treatment is to treat the Lyme. As you get the Lyme under control, usually those will go away, okay? All right, thanks for that question. Hello, Mary. Let's see. My vision has become so blurred I can hardly see the TV. Is this mold, Lyme, Babesia, Bartonella, or a combination? So first of all, I don't know why you have blurred vision. The one thing I would want to make sure that you do is get an eye doctor to take a look at you. They're going to want to make sure that you don't have common things like glaucoma, like cataracts, like somehow you've had another maybe diabetes, any kind of ocular changes that are not Lyme related, okay? But it is possible also that Lyme can sometimes lead to blurred vision. Probably it has to do more with neurologic Lyme or neurologic Bartonella that make it difficult for the lens to focus, and the lens has to be held into position by muscles that pull it, and those muscles get nerve signals to tell them to do it, and Lyme and Bartonella can infect the nerves that make those muscles work that cause your lens to keep its form and shape. Okay, so yeah, it could be that you're getting blurry vision because of Lyme or Bartonella that can do that, okay? But get your eye doctor to look to make sure there isn't another explanation for it as well too, okay? Hello, Shivani. Let's see, hi, Dr. Ross. How long is too long for antibiotics? At what point do they start doing more harm than good? It's a good question. We don't know. So whenever you use an antibiotic, you have to weigh out risk and benefits, okay? So let me get situated here. So anyhow, the risk of not using antibiotics is if you have Lyme, that the germs, Lyme and co-infections, that the germs cause problems in your body. And those problems can become progressive, okay? That's the risk in not using antibiotics. The risk in using antibiotics is you knock down good bacteria in your intestines, and that good bacteria may have some good functions for us. One is it can prevent you from getting too many yeast. All right, so the other thing is, so we call those good bacteria, the germs that live in our intestines, we collectively call them the microbiome. We, to put this in context, how important our microbiome is, if we look at genetic studies about the genetic material that's in our bodies, approximately 90% of the genetic material that's in our body is from the germs that live in our intestinal tract. 90%, okay? We're letting a lot of passengers just hang out in there, all right? But we're not just letting them hang out, and we're not just letting them take food from us and feed them. We're getting stuff from them. We don't just let 90% of our genetic inhabitants just be there for no reason at all, right? So the idea of how important the microbiome has been getting a lot of attention in the last few years, and we are really just scratching the surface of the importance of it. But things that we know that the microbiome can do is, number one, it can regulate the immune system. It can keep yeast from growing in your intestines. It can aid in digestion. It can help with detoxification. It may make up for genetic defects that we have, like it may correct an MTHFR detoxification defect. It may make the things we need to correct for that, for instance. It may help with detox. It may make, or it does make, nerve messengers that are made by the bacteria in the gut regulate our brain. Okay, so the gut microbiome is huge and is important, is huge. But yes, we may cause some injury to that, but you have to weigh the injury that having Lyme and co-infections in you causes too. And the question is, what's the right balance? And that's between you and your physician to decide how long is going to be enough to get those germs under control relative to the risk. But those are things to consider. Okay, so I don't have a set answer for you on that. It's a matter of weighing risk and benefits. All right, thanks for the question. Hello, John. Let's see. Hi, Dr. Ross. Thank you for all you do for the Lyme community. Can you use IV antibiotics with herbal remedies to combat Lyme and Bartonella? So John, yeah, you can do that. I use either oral or herbal antibiotics sometimes in my practice. I have no problem complementing those two together. So that is possible to do that. But I definitely would, talk it over with your providers, see if they're comfortable with that and knowing what you're doing, what you're trying to treat. Okay. All right. Thanks for the question. Hello, Lynn. Let's see. What are you seeing in Lyme patients who get acute COVID as far as severity of disease versus main population? And same question about long haul post-COVID syndrome. Any new preventive protocols or treatments for the disease? Thoughts about ivermectin? Okay, so first of all, what I am seeing in my practice is I do not think that people with Lyme in general have any greater chance of getting COVID than anyone else. Nor do I see in my practice that they are having any greater problems handling COVID than anyone else. That being said, I have had some of my Lyme patients that have become long haulers because they got COVID-19, okay? But I don't think it's happening at any other greater rate than it is happening in the general population, okay? All right. Now, in terms of my preventive regimen, and my thoughts on ivermectin. What I will tell you about ivermectin is there is some laboratory evidence that says it might be useful at either preventing or treating treating COVID, but the laboratory evidence is sketchy and not of the highest quality. In fact, the National Institutes of Health at first was originally saying don't use ivermectin. There's no evidence. I think about 2 or 3 weeks ago, they modified their statement about ivermectin, saying that there's not enough evidence saying it does, nor is there enough evidence that says it does not work. So the NIH has come out neutral on it lately. As I review the science, I think it's some pretty crappy evidence. I mean, meaning in terms of quality of science, but there still is some evidence that says it might help. And I think it's a relatively benign drug. And so therefore, I am using it with my patients that get either acute COVID and they're out of the hospital, or if I've got somebody that's been exposed to COVID as a means of preventing it, okay? There are other steps you can take for COVID. I'm not going to have enough time to go through them right now. Let me show you my article where I have written about prevention and treatment of COVID. And it's a current article. Let me see here. All right, so take a look at my information site here. Just you can search, just write COVID, and you'll find the article. It's this one right here. And in here, I talk about ivermectin. I talk about other prevention strategies as well. You'll have to read the whole thing. There's a lot in this article, okay? All right. All right. Thanks for that question, Lynn. And then let's see, I think I'll take one more here. Hi, Mary. Let's see, if I came to you as a patient, how would you begin to sort out and prioritize multiple issues? It's a good question. I mean, Mary, you raise a good question. So the thing is, sometimes you cannot treat everything at the same time, okay? And so if you look at my treatment protocol, you'll kind of get a sense of how I would prioritize. So things that I prioritize always are sleep, getting inflammation under control, treating yeast, supporting the adrenals, supporting thyroid. Those are like key steps. But if somebody got sick and the biggest thing that may have given them sickness first is mold, I'm going to treat that first, okay? So to look and see how I might prioritize the issues I would focus on most first. And yes, at a first visit, I'm trying to decide, boy, where are we going to start? So I do try to prioritize, but the way I make a determination is I take a good history to find out what is the thing that gave you most likely the most of your problems and start there first, okay? But I have to take a detailed history to do that. But if you're wondering what issues I would focus on as I'm considering, take a look at my treatment protocol here. And in here, you'll kind of get an idea how I work, okay? Which is, I tried to say, there's some things I say before you treat Lyme. Make sure it's not mold. If it is, and it looks like that's the greatest reason why you're sick, treat it first, okay? I also talk about fixing mast cell activation or starting to treat it before you start doing most of your treatment, all right? But then focus on sleep, deal with your diet, get inflammation under control, deal with things that support your adrenals and thyroid. Anyhow, read through here. You'll see the things that I focus on in my practice, okay? But yes, I can help you figure out, prioritize, where do you start? And the way that I make the decision about where you start is based on the history of how you got sick and what is the most likely thing that gave you the biggest problem. We start working there first, okay? All right. Thanks for that question, Mary. All right, everyone, that's it. That's it for me for tonight. So we will be off next week, but when you get the email tomorrow morning from me announcing that the webinar recording is done, it'll include a link to sign up for the webinars, which will begin the second week in March, okay? Take a look in your emails, probably somewhere around 9:30 in the morning tomorrow. I should have the recording edited and out to you, announcing it in the email. Again, help me to spread the word to help people. So when you get that email tomorrow morning, forward it to people you know that have Lyme that might get benefit from it. And also when I send out emails announcing new webinars, feel free to share that or help me by sharing that to as many people as you know that might get benefit as well too. Okay. Thanks, everyone. Good night.